Waiting to get your next COVID booster? Well, we might have some good news to share tonight.
Yeah, an updated shot to protect us from new variants could be available very soon now that the FDA has cleared the way for them. Our Melissa Kim is here now with some new reporting on what comes next. Pretty big deal here, Melissa.
Yeah, indeed, guys. The CDC advisory group is scheduled to meet tomorrow to make a recommendation and approve that new COVID-19 vaccine, which means it could be available in just a matter of days. But where are we right now with the virus? I spoke to a local physician to find out. Nationwide, we've seen an increase in the number of people testing positive for COVID-19, anywhere from 10 to 15%, according to the CDC. In our region, the latest data shows about 13% of people who took a COVID test were positive. And experts predict those numbers will go up as we enter the fall and winter months, especially with kids back in school.
All the kids suddenly are sick within about 2 weeks after the start of school because that's when they are congregating in tighter enclosed spaces.
Dr. Christina Johns is the senior medical advisor at PM Pediatric Care, the largest pediatric urgent care group in the country. And she says perspective is important here.
This isn't just something to take lightly. And while I certainly don't mean to fearmonger in any sense of the word, I think acknowledging that it exists, that's just the science.
But there is some positive news.
There's really a silver lining here, and I think that none of the data so far suggests that we are heading back into the heart of the pandemic.
Given all of that, she recommends, especially if you are in a high-risk group, contact your physician so you know when you should get the new COVID vaccine.
We always say that prevention of anything is much better than having to treat anything.
As for what to do in the meantime, get back to all of those basic rules of good hygiene if you're not already practicing them.
It's a good time to remember that hand washing is really an important part of public health prevention and infection control.
And in some severe situations, don't be surprised if masks come back, especially at schools.
Folks may want to even start to consider mask wearing. I know that some schools in the midst of a surge are having some temporary mask requirements in the classroom.
So now there is one big difference in this rollout of this new COVID-19 vaccine, according to Dr. Johns, because it will not be government funded, so you'll have to get it through insurance. But she says most, if not all, insurance providers are expected to cover the vaccine, but make sure to check with your provider first to make sure. Leslie?
As soon as I can get that shot, I am getting
Me
it
too.
for sure. Thanks, Melissa.